and welcome back to my channel. So I want to talk to you about constipation post weight loss surgery. So I had gastric sleeve surgery, so I'm basically just going to discuss that with you today because bypass surgery is going to be a little bit different, only because there is a little bit more bowel involvement. So constipation is very common and it's actually expected post weight loss surgery. And the reason for that is, one, you're on a liquid diet, two, you're on a very limited liquid diet, and three, you're probably not moving around as much as you normally would. So it was a big issue for me about being constipated. I was worried about bowel obstructions and all that sort of stuff. And then moving throughout the days and the weeks and going, I haven't actually had any movement and I'm not uncomfortable, but I still would like something to happen. So what I was initially doing was I was taking Coloxolin Senna, and I was able to swallow these tablets whole. Like, you don't have to break them up. I was taking them 2 a day. I'm just going to show you the size of it. I don't know if you can see that. It's only very small. And they're sort of coated, so they're shiny and they're easy to swallow. So I was taking them twice a day. I was passing wind, so for me, and generally speaking, if you are having bowel sounds and you're passing wind, generally means that your bowel is working. For me, it just meant that I wasn't getting the intake in. So please just remember that this is from my point of view. And although I'll say generally, it means, it means very general. So everyone's circumstances are very different. If you do have bloating, if you have abdominal pain, if you aren't passing wind, I found that I had a lot of those sort of gurgly sounds, which let me know that things were working. If you feel like, just really unwell, if you have a temperature, if you've got abdominal pain, any abdominal pain that's different from what you had post-op, immediately post-op, and you haven't done something that has caused you, strained yourself or overdone it, then please go and see your doctor, call your surgeon, call your nurse, go to the hospital, because it could mean that something else has happened. And it doesn't necessarily mean a bowel obstruction. It could mean, scar tissue, adhesions. It could just mean something else, and that you might need to have further interventions. Something also that I need a big flashing light is that if you're taking medications like endone or anything with codeine in it, please, please, please be mindful that this will increase your risk of constipation. And if it does get bad enough, you will be hospitalized and you will need surgical intervention. I do know somebody who's had that done in the past, and it's very unpleasant. So please, please be mindful. If you are taking any analgesia or pain medication that has codeine in it, any medication that you're given with a prescription, ask your doctor or your surgeon, your nurse, before you leave the hospital, or ask your pharmacist before you leave. Say, will this give me increased constipation? Or will this, increase my risk of constipation? Another thing to be mindful of, if you're taking an antiemetic, so a Maxilon, ondansetron, or Maxilon's also called metoclopramide, anything that's going to help with nausea, this can also cause some constipation as well. So these are just things that you really need to be mindful of, just as a whole. As a side note, I only took pain medication, like strong pain medication, 3 times. Actually, maybe 4. Let's say 4 times. I took it the night that I was in hospital, the day that I drove home, because it was an hour drive home, and just to be on the safe side, that night, just because I was in the car and things were moving around, I just wanted to, make sure that I wasn't going to be in any pain. And then 3 days later, I had a rotten headache, and I took Panadol and it wouldn't go away. And because I couldn't take Nurofen or Asproclear, it was my last resort. So I took that, and that was it. I haven't taken it since. So I knew that wasn't going to be an issue for me. Then around day, it was Saturday, last Saturday. So that was, what are we? So around day 10, I still had the wind, I still had the gurgly sounds. The Cloxland Center wasn't doing it for me. So I was like, right, we need to step this up. And then I went and bought some, if I get it the right way, Movicol. This is flavor free. And I swear I read somewhere that it doesn't have the salty taste, but I feel like it does. Anyway, they're sachets. I put 2, just because that's what I would have normally done. In hindsight, I probably only needed to do 1 dose. So I did 2 sachets in the Saturday evening, 2 Sunday morning, and 2 Sunday night. And it was all systems go Monday. And I have, when I say all systems go, I'm not saying that it was anything to write home about. Again, you have limited intake, so there's not much in there to come out. But I had a movement, and that was, okay, check that off the list. So what I do is, in my last video I showed you how I do my hydration. So I use these, I use the Collagen Company sachets as well. And I use the flavorless protein powder in my water with ice cold water, so it's all refreshing and delicious. With my Movicol, because I strictly want to have the fluid in here solely for my hydration. So because Movicol will take that fluid and draw it into your bowels to make you go. I put this in Hydrolite. So I just mix it in with water, then I chuck a Hydrolite tablet in, and that way it's just extra hydration. So the Movicol doesn't take away from the nutrition that I'm already taking, or the nutrition I'm normally having. So I've just sort of bumped up my nutrition, bumped up my hydration, not my nutrition, my hydration intake for when I'm taking the Movicol. And I feel that made more sense to me. Again, you don't have to do that. And they do recommend that you have to be drinking at least 1 litre of fluid before starting any of the aperients, any medication to help with constipation. You need to be taking in at least 1 litre of fluid. So that's just some food for thought. And things are moving. I'm happy, I'm comfortable. I had no bloating, no abdominal pain. I haven't been uncomfortable. I did speak to the nurse about it. She was fine. She was like, yeah, that's expected. So these are just my little handy hints and tips. If you're not from Australia, I bought this stuff from Walgreens. I was in New York in May, and I bought this stuff from Walgreens called Powder Lax, I think it's called. And I thought that was very effective too when I was in New York, because due to my medical history, sometimes I do need a bit of extra support. And although the Cloxland Center are great, long term they can make your bowels lazy because these tablets do the work for them. So doing the Movicol is definitely the better option, and I would definitely recommend Movicol or any similar brand to that. So I really hope that this was the conversation you were hoping to have, or hoping I would have with you. And it's an important one, and it's something that can become very serious very quickly if it's not addressed. And I hope that, it was informative as well. I would like to thank you for watching, and I will talk to you very soon. Bye.